Welcome to Microcare Medical, your trusted partner in surgical instrument and endoscope cleaning. In this video, we'll show you how to use the Spec Clean Endoscope Sponge for immediate pre-cleaning of endoscopes, as recommended by ANSI standards. Pre-cleaning should take place at the point of use immediately after the device is removed from the patient to prevent dried soils and ensure best cleaning results and patient safety.
Hi, I'm Rich Scavo with Pioneer Endoscopy Solutions. Today I'll be showing you how to clean your endoscope using the Spec Clean Endoscope Sponge. Let's dive in.
First, let's talk about the importance of proper endoscope cleaning. It's not just about hygiene, it's about patient safety and equipment longevity. Improper cleaning can lead to infections, equipment damage, and costly repairs. Always wear proper personal protective equipment to minimize exposure to potentially harmful substances. A little water and our specially designed Spec Clean Endoscope Sponge make the pre-cleaning process efficient and thorough, ensuring all areas of the endoscope are properly cleaned and sanitized. The Spec Clean Endoscope Sponge is compatible with a wide range of endoscope models, and its effectiveness is backed by rigorous testing and validation. Spec Clean Endoscope Sponge is individually vacuum packed for your convenience. It reduces time and effort following procedures. No measured dosing is required, and its powerful multi-enzymatic formula immediately starts cleaning to prevent dried-on soils. Before starting, ensure the water-resistant cap on the endoscope is secure to prevent fluid from damaging the sensitive electronic parts inside. Step 1. Open the Spec Clean Endoscope Sponge packaging and remove the pre-saturated sponge. Place it in water and squeeze 3 to 5 times to activate the multi-enzymatic detergent. Step 2. Lightly squeeze the sponge and wipe off the exterior surfaces of the endoscope. Step 3. Place the distal tip of the endoscope into the solution. Soak for 1 minute and then wipe with the sponge. Step 4. Your endoscope is now pre-cleaned and ready for transport or transfer, for cleaning, sterilization, and storage. In summary, proper endoscope pre-cleaning is crucial for patient safety, equipment longevity, and regulatory compliance.